Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about postoperative care that you do after the surgery if you have hammertoes. Hammertoes are a big deal only if they start to interfere with your life, only if they start to hurt and so forth. But when you do surgery, most of the time you're doing a pretty significant bone procedure, whether you're cutting bone and just taking it out, or whether you're doing fusion of a joint. And in both cases, you need to protect that foot for at least 4 to 6 weeks. The best way to do that is in either post-op shoe or boot, where you actually limit the pressure across that. If you do certain surgeries where you actually have a pin that's sticking out, which I rarely do anymore, then you have to even protect more because you don't want the pin to get caught and be pulled out prior to the 4 to 6 weeks that you want that in. So what is the care post-operative? Anytime I do a surgery, I recommend that for at least 48 hours, they limit what they're doing almost completely. They're down, foot elevated, ice on it. You can put ice on the foot, ice the ankle, even behind the knee. It still cools the blood going down to that area. Number two, you want to protect the area. So you want to leave the dressings intact and change them as little as possible during that initial period to reduce the chance of infection. Number three, you want to keep from injuring the area that had surgery. That's why you will be in a boot or a postoperative shoe during this period to protect it. And number four, you're going to do medications as needed. A lot of times you may not need strong pain medications in this case, but because it's bone surgery, sometimes individuals do, especially for the first couple of days. So pain medication can be used. Ibuprofen can also be used. The biggest thing is ice and ibuprofen or anti-inflammatory type medications are going to have the most beneficial effect as far as pain control because it's the swelling that hurts. So if you do some of those typical things, you can actually allow it to recover pretty quickly. And a lot of times you can get back to normal relatively quickly as the bone heals, as the wounds heal, as the stitches are removed, usually at 10 to 14 days and so forth. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 258.